Hello, my name is Dr. Syed Arshad Husain. I'm a consultant pulmonologist. I'm also adjunct professor with Gulf Medical University. I'm talking about the subject of bronchial asthma, and I get a lot of questions regarding that. The important thing to understand about asthma is this is a variable disease of the small airways and the airways, which gets collapsed or which gets narrowed down. There's a lot of secretions that also start to build up in the chest. Sometimes patients come to me and say, "Doc, I have cough," and it's very unexplained. It's just continuous cough. It's not settling with treatment. So cough could be a presentation for allergy or asthma in the airways. Sometimes they come with shortness of breath. Sometimes they come with wheezing, which is like a whistling noise in the chest. They sometimes come with chest tightness. All of these things are very much important to understand. They could all mean that you have bronchial asthma. Again, it is very important to understand what exactly is the mechanism behind it. Usually it's one of the triggers that start this process, and the triggers could be a viral illness, a bacterial illness, or even COVID or flu, or it could be something in the atmosphere. Like our environment has got a lot of high amount of dust in the atmosphere, and sometimes when there's a dust storm, it could lead to having people the exacerbations or symptoms of asthma. There is also possibility of pets in the house like cats or dogs, and their dander in the atmosphere can also be inhaled and cause this problem. So what exactly happens in asthma is very important to understand. As I say, it's a variable disease. On a good day it will be good, on a bad day it will have bad symptoms. And sometimes you have one symptom out of all I will describe, or sometimes more than one symptoms with these patients. And again, the main problem to understand is what is shown on this model, where the airways become tight and narrow, and there is secretions of bulgum in there, which is what is causing the narrowing, and the body identifies that as a foreign body and then starts coughing and coughing and coughing to bring it out. But the phlegm is sometimes very small to come out, so it just is a repeated cycles of coughing. So hence it is very important when you have a chronic persistent cough, then you come and see the doctors who could help you. We certainly in our clinic would do a chest x-ray. We have a very important investigation available here called FeNO, which is exhaled nitric oxide that we can check in your breath. It's a breath analyzing test. Along with that, we can do spirometry and some blood tests where we can check immunoglobulin E, and we can also check for eosinophil count in the CBC. So all these things are very important to work out if somebody's got asthma, and then we can do allergy testing to find out what they could be allergic to. There are some very important messages to convey from my side. Some people find it difficult when their AC is and something related to the air conditioning system. The air conditioning system should at least be cleaned every 6 months. The ducts should be cleaned thoroughly, because there is some mucus and there is fungus that goes and sticks there and causes the problem, because we live in a very much indoor environment because of the climatic condition. So it is very important to have your air conditioning checked up and cleaned up. And again, to find out what's causing this symptoms is important. So I will show on this model in a bit more detailed way exactly what's going on. But sometimes it is picked up on these tests I've talked about, the FeNO, the spirometry, where we look at also not only the large airway but also the small airways, which gets narrowed, and there is bulgum and secretions. So we use some inhalers to treat this kind of condition, and we move from this model showing here into this model where there is no bulgum and the airways open up. They're not tight and narrow as shown in this model. Thank you.